Welcome to the PTUB Pod, an educational podcast created by paediatric trainees in the Southwest.
Featuring reviews of journal articles and interviews with authors and specialists.
Please note, these are our own opinions and do not substitute professional medical advice.
Thanks for listening.
Hi there, I'm Lorna. I'm a paediatric trainee in the Severn region. And today I will be speaking with Priyank, a clinical fellow currently working at Great Ormond Street Hospital. This episode is going to have a slightly different slant to it, as we will be discussing the patient experience, which I think is something we are all striving to understand better. It's just so important. Today we are hoping to shed some light on what it is like to live with AML and afterwards, and how these insights can shape the care that we provide to oncology patients and their families. Just a disclaimer before we begin. Because we're talking about the lived experience of having a cancer diagnosis, this can be an emotive topic, and therefore feel free to tune out at any point if it's not for you. Welcome to the podcast, Priyank.
Thank you, Lorna. Thank you for the introduction, and a very good morning to you.
Good morning to you too. It's a lovely morning today. Can you tell us a little bit about yourself?
I'm currently living in London. I'm pursuing a clinical fellowship at Great Ormond Street in the field of paediatric hematology and oncology. I completed my medical education back in Mumbai. So I was born and raised in Mumbai. And that's where I completed my schooling, my medical education, my post-graduation in pediatrics, followed by a fellowship, which was an enriching experience and taught me a lot. My current clinical focus is on pediatric cancer, and what makes my journey slightly different is that I was once on the other side of the bed as a patient, and I would like to shed some light on that as we go forward.
Perfect. Thank you. I'm assuming it's the diagnosis and the impact it's had on you that made you interested in speaking on this podcast today.
Yeah, sure. So I feel speaking here feels important. I would like to share this with the viewers that I'm a childhood leukemia survivor. I was diagnosed with acute myeloid leukemia when I was 17 years old. It's a rare and a humbling thing, to be able to tell your story in a way that might resonate with others. I agreed to talk on this podcast because I believe lived experience has value, especially in medicine. We talk a lot about patient-centered care, but hearing from those who actually been the patient, especially in adolescent period, can be really eye-opening. And I want to speak for those kids who might not have found their voice yet, and to share what this journey has taught me.
That's incredible, really. You're right. We don't often have enough time with our patients to have these more real conversations about what they're going through.
Exactly.
What impact did your diagnosis have on your life and on your goals?
I think, as I said, I was 17 when I was diagnosed, and you're supposed to be looking forward at that age. But when you're diagnosed with cancer, you live one day at a time, probably 1 hour at a time. And there's a lot of fear involved as well. There were moments of despair, but also there were moments of incredible clarity. I started to realize what mattered the most to me, which was people, purpose, and my time. Medicine was always a quiet interest of mine, but going through treatment transformed it into a calling. Becoming a doctor was no longer just a goal anymore. It was just about being someone who understood suffering firsthand and could care with both knowledge and heart.
Wow. You said that really, really beautifully. Going back to how it affected you initially, when you started treatment, can you explain a little bit about the effects that treatment and presumably hospital admissions had on your day-to-day life?
So I would say the entire experience was quite grueling, but also comfortable. It included long hospital stays, infections, fatigue, nausea, multiple blood transfusions. There were days I couldn't get out of bed. Chemotherapy was harsh because that's the first line treatment. It included frequent admissions with febrile neutropenia and a lot of other small things which needed tremendous supportive care. I lost significant weight. I lost all of my hair and also my sense of control. I became immunocompromised so that I was isolated a lot because of the ongoing infections, the hospital-acquired infections and stuff. I felt like time was just passing me by. I did struggle a lot with fatigue, nausea, cognitive fog. Some days reading a page felt like a marathon to me. My hobbies, which were like music, sports, reading, all took a backseat at that time. Everything came to a standstill, and everything became clinical as well. You start organizing your life around test results and appointment schedules, and
Gosh, yeah.
it's just your life is flipped overnight.
Yeah, there's so much to unpick, isn't there? And I think
Exactly.
you mentioned the fact that you reach this state at times in your treatment where there is just nothing that you're able to engage with.
Yeah.
Yeah, very hard to keep a routine and have things that you enjoy to punctuate your day.
Exactly, and it's very important to be calm during this moment. And acceptance, I feel, is the major part, because a lot of teens have their own set of ways, their own routines, and when that is disrupted, they do feel violated and they do feel that they're not in the right place. So at that time, when you know you do not have any other option, accepting the current moment as to what's going on with you keeps you more happier and more grounded.
And it has a drastic impact on your life and everyone around you. Did it disrupt your education at the time? I presume it did.
Yeah, it did disrupt my education for a brief period, I would say for a year or so. Then I had to take a year off from my medical school because I was in my first year medical school, I do remember. And I had to start all over again. And the batch of friends with whom I was working and studying at the time became distant. So, and I had to also cope up with a lot of late effects, side effects of the medications. I required a lot of physical rehabilitation as well when I came back to Mumbai.
I think we've very commonly focused on the grueling effects of treatment itself, the toxic effects they have on the body, and that's what everyone associates with a cancer diagnosis.
That's true.
But we've spoken about how the basic routine of day-to-day life is disturbed. You're in hospital, you're not having your usual food, there's trouble sleeping. And here I'm just going to share a few statistics from the Under 16s Cancer Experience Survey from 2023. So, unsurprisingly, 25% of parents and children said that it was quiet enough for them to sleep in the hospital. So, I mean, that's a tiny proportion. And 47% of children or their parents felt there was enough for their child to do in the hospital. Do you have any thoughts on the best ways to reduce the impact on these routines?
Definitely. So I would like to share my experience. Definitely, as you mentioned, Lorna, sleep was a huge issue that time. Machines bleeping, vitals at 3 a.m., noisy corridors. For me, my earplugs, my iPad, advocating for rest periods helped. The supportive care I received from the medical team helped as well. Food was another challenge for me because I shifted countries. I was treated in the United States. I had to leave Mumbai, and I had no clue when I would return back. So for me, appetite changes, nausea, the hospital meals, they usually don't mix well. For me, I think allowing some flexibility in the routines, such as letting parents bring familiar foods, but taking care at the same time that it's freshly cooked, bacteria free, so that nothing happens to the patient, can go a long way. Small things like that, I think, make the hospital feel a little more human.
Yeah, sort of the personal touches that your family can bring in make a
Definitely.
big difference.
Yeah. Because I think
So,
you are at an age which you are feeling really vulnerable, and you need to share a lot of things which you cannot share with your parents sometimes, like you need your friends, you need your space, which I lost at that time. And so my parents became my confidant, and I had to rely and become independent all over again.
yeah, it's a huge dynamic change within the family, especially if you're a teenager
Yeah,
and you're used to being independent and you're growing in independence at that point. So it's
exactly.
almost feels a bit like a backward step, I suppose.
Definitely, Lorna. Yes, it does.
Since we brought it onto the impact on your family, can you speak a little bit about how the diagnosis and the treatment affected those closest to you?
Obviously, it came to me as a shock because one day I'm a medical student living a normal life, and the other day I'm faced with a diagnosis which I hardly can process in a few hours. And people are telling me that you need to leave the country because obviously at that time your parents would think what's best for my child, right? And where is the best place I could get my child treated. So my parents at that time were extremely upset, disappointed, seeking help in terms of where would be the best possible treatment. And then we ended up booking a bed in the United States at St. Jude Children's Hospital, which is one of the prestigious institutions for pediatric oncology and hematology. And I'm grateful that I got a bed in such a busy hospital. And I feel grateful that I got treated and I'm alive in the first place. I think it was even harder for my parents. My parents became my shadow during the treatment. My mom became my full-time caregiver. She slept in the hospital chairs, helped with medications, held my hand when I was scared. My dad held everything together back home. We were also emotionally stretched a bit. And as a teenager, I was at a stage where I wanted space, but cancer made me completely dependent again. It affected my friendships as well. Some people disappeared, not because they didn't care, but probably because they didn't know how to show up. But others
Yeah,
surprised me by standing by me in ways I'll never forget. You do learn a lot about people during crisis.
definitely. And I think you've mentioned a really important point of the uprooting of your family.
Yeah.
I mean, for you, it's, vast distances, but I think for most families, they're uprooted in some way because
Definitely.
they're transported into the hospital environment, and they almost have to have like a sort of secure base there, but then they also need to support their family at home and possibly other relatives. And it sounds like your family was, really stretched across continents.
Yeah, and one more thing I would like to add is that both of my parents are GPs back in Mumbai, so they had to leave their practice for don't know how long. Nothing was decided, and then they just supported me. My mom and dad came along with me without caring what would happen back at home. I also had twin sisters who had high school exams coming up. So it was quite difficult, and that's when you need most support.
Wow. Yeah, I think I would agree with you that that's really challenging because your parents you've already got more than one child that you're trying to support. And in this situation, you've got children with incredibly different needs and crucial points in their life. So it must feel really stressful as a parent.
Yeah. And it doesn't end when the treatment ends, that in leukemias, usually you give a period of 5 years post treatment ending. And if the disease comes back in that period of 5 years, then it's really difficult to deal with. But fortunately, hopefully, I have been clinically well, and I've been following up myself, and everything has been pristine so far. So
Wonderful.
I'm grateful. Yeah,
Your family, it sounds like, have been a real rock for you throughout this journey.
definitely. I owe everything to them, to be honest, because if that was a period where I was so vulnerable and so weak, and if someone supports you all the way through that period, I think those are your people.
If we go on to speak about conversations with healthcare professionals and your involvement in your care, do you have any memories of key conversations with health professionals that stood out to you?
Yeah, sure. I do remember a few. I remember a nurse who spoke to me like a person and not a diagnosis. She explained things without oversimplifying or overwhelming me. She was a very good support at that time, and I started sharing my own thoughts and my feelings with her, and she really, really supported me very well that time. She also asked me one of the evenings when I was getting my treatment and there were tubes connected, I do remember, and I was feeling really icky. She just asked me, like, what has the hardest thing so far, which has been for you? And I was really taken aback by that statement because no one usually asks that. And then sharing your own thoughts and feelings with that person did help. I also remember my lead consultant, who was so humble and so round to earth. He was an inspiration to me. He explained the diagnosis beautifully, considering I was a medical student back then, and would
Of
answer
course.
any doubts or any issues I had without hesitation. So these two experiences did stand out for me.
Just really strong examples of good communication.
Yeah.
And it sounds, from what you mentioned, going back to your conversations with the nurse and what she said to you, she acknowledged that it was hard, it was difficult, and I think maybe that can sometimes be a bit of a taboo. You know, perhaps people don't want to ask what's been difficult for you, because then it, almost
Yeah.
emphasizes the struggle aspect of it.
It does. But I think I was in a very different phase at that time. I couldn't process a lot of things. That nurse at that particular time became a friend for me. And
Yeah.
being a teenager, I experienced that I could share my feelings and my emotions with her, even though she was busy and it's difficult to keep track of everything.
And I suppose you don't always know who that person's going to be, and sometimes you just need someone who's a kind face
Yeah.
and independent from everything else. Even though she's a healthcare professional, she's kind of a separate voice from your family and from those who are, the doctors directly treating you, perhaps.
That's true.
And I think that's, again, just demonstrates how you just need people to be kind and to talk to you in a very human way.
Because at that time, if there are a lot of things to talk about, your illness, your side effects. As a teenager, we don't want to hear all that. We want to hear that you're going to get better. We are there for you. If you have any questions, if you have any concerns, do come to us.
Do you think the amount of information, you've mentioned a few times that it was overwhelming, particularly at the sort of early stages.
Yeah.
Do you think information overload is generally a problem for teenage cancer patients?
Yes, I feel a lot of information can act as a double-edged sword. And I just feel that teenagers are really vulnerable. So you need to balance out what you speak as clinicians, as to how much time you need to give to the diagnosis and how much time you need to give to their mental health. So it's pretty difficult to make that balance, but it is necessary, I feel. Yeah.
As health professionals, you often feel like you need to give all the information, especially now we're in more of a culture of parents and families being really informed.
Yeah.
So you want to be open and honest, but it's knowing how to time that information for the family.
That's true.
A few further statistics that I'd like to bring in here. Again, this is from the Under 16s Cancer Experience Survey. For 73% of parents, carers, and children, their diagnosis was given to them in a way that they could understand. Probably a number that needs to be higher. Another statistic was that 57% of children or their parents were not told different things by different staff members that left them confused.
Mm-hmm.
I think this one in particular can often be quite an issue that I've seen in practice.
Yeah. So I feel clinicians or whoever is reiterating the diagnosis to the teenager who's affected with cancer needs to be really clear. As I said earlier, that person needs to be involved in the medical care and the treatment decisions, because you are going to give a drug to someone so that that person becomes better, and that person needs to know exactly what is happening with them. Being a teenager, you are aware of everything that's happening around you. So I just feel clinicians should speak directly, respect their maturity while understanding their fears at the same time, validate their emotions and ask open-ended questions to them. Don't sugarcoat things unnecessarily, and also balance truth and compassion at the same time.
Which is really, really difficult in practice.
It is difficult. But I think taking out, as I said earlier, a few minutes of your time just to make that person feel better, more confident, does help.
Definitely. I do think it's difficult to combat the being told different things by different people. I mean, that statistic, 57% not told different things. So that's 43% were told different things by different professionals.
Yeah.
And I just think everyone has different ways of phrasing things. That's just unique to who we are as individuals. And I think obviously because everyone will use slightly different words, even that can be quite confusing, especially if you're really focusing in on everything that everyone's saying to you.
That's true. That's true. I do feel that I need to be involved. Like, for example, I wouldn't like if some doctor is explaining my own diagnosis outside of my room with the doors closed and my parents listening to them intently and me being left out. So that's one of the things I would like to raise as a clinician. Whenever you are putting out the diagnosis to them, do involve your patients and be extremely empathetic and respectful towards them.
That's so true. Yes.
Yeah.
I think parents are often so protective, aren't they? Which is wonderful. And I think sometimes parents do know the best way to explain to their own child. So I think you've got to be respectful of that, but also not exclude the child if they want to hear it from you.
Yeah. So, as you said, Lorna, parents are protective and they do hide things from their own children so to make them feel safe. And so, for example, not telling them the grave prognosis or for not telling them the side effects of the treatment, parents feel that their children would overthink things and get sad, upset. So probably they start hiding that, but probably that's just a protective mechanism, right?
Yeah, and it's probably is beneficial at certain points within the treatment, and I think that's why parents are a great resource for doctors, because they will know how their child is feeling on that particular day, their mood, how much they're struggling, and so if you're having those open conversations with parents, you then perhaps how much information the child is going to be open to on that particular day.
Definitely. I mean, I do agree with that. For example, in my institute, whenever a new patient comes in, I do spare, even though the schedule is super busy, I do spare a few moments or minutes just to make them feel comfortable. And sometimes if the parents and the child are going through hell, it really makes sense going inside, just talking to them apart, just not the diagnosis, not the hospital, not the medications, just heart to heart conversations, because very few people usually do that. And I feel my experience being on the other side of the bed has helped me cultivate a sense of empathy and be more calmer, and that has helped me to talk to my patients in a way that makes them feel comfortable.
Yeah, there must be so much that you see that others who've not had your experience would struggle a lot more with. I'll bring in just a couple more statistics and then we'll move on. 69% of children or parents felt they were definitely involved in their child's care or treatment, which again is a concerning statistic. Positively speaking, 82% of children said they were well looked after by staff for their cancer or their tumour. The survey definitely highlighted that involvement of the families can often be quite a challenging area. In the ADC, there is an article from 2023, which I'll pop in the show notes, where they use qualitative methods to gain patient and parental perspectives on national advisory panels in the UK.
Mm-hmm.
And these panels are a group of experts in a particular branch of oncology who will provide specialist advice via meetings to local oncology teams.
Mm-hmm.
And usually the child and their relatives are not present in these meetings. However, the study highlighted the clear importance of having either a clinician or specialist nurse who knew the family really well, who could advocate for the family's personal views and treatment preferences. Because these specialists are investing time in tailoring a treatment pathway. And if this pathway didn't even account for the patient preferences, it's potentially inefficient and unhelpful. And the conclusions from the study really were that we need to ensure that family-related factors were included on the referral pro forma, including psychosocial circumstances and treatment preferences. And also, patients need to be informed of the referral and of the outcome, with, most importantly, sufficient time allocated to actually spend time sharing the information from the meeting with the family.
Exactly. I feel it's one of the most important things to do. As I said earlier, you have to work as a team, right? You need to keep everyone in the loop, and they need to be involved completely in their care.
Do you have any good examples of how we can support teenagers to be involved in their care?
Yes, definitely. I feel teens who are undergoing treatment should be given a lot of play activities to keep them busy. And also people like play therapists, psychologists, psychotherapists, which really helped me cope with my illness. Also, I had free access to a lot of books, activities, reading, Xbox, PlayStation. Also, talking to them, as I said, getting a psychologist into play, because most of the teens do feel sad or upset when their treatment is ongoing.
And so you think that having that psychological support is the best way to encourage teenagers to be more actively involved in their care and their treatment?
Definitely, because if you win their confidence, they would be more than happy to get involved in care and treatment decisions. And it helped to have someone talk about, for example, body image issues, fatigue management, or just how to mentally prepare to face these treatment milestones.
Of course. Did you have quite heavy input from a psychologist during your care? Can you speak about that a little bit more?
Yeah, sure. I did feel isolated at times. I did feel alone. I did feel depressed, which is a very common occurrence for teenagers undergoing cancer treatment. And opening up to her really helped me become more calmer, more understanding, more free, so that I could share all of these emotions and feelings with someone.
You've mentioned psychologists, I think dietitian, play therapist. Are there any other professionals we've missed out that are really were crucial, do you think, to children when they're undergoing cancer treatment?
I think nurses play a crucial role in a treatment, and they are usually always not given much importance. But I feel the nurses are the backbone of a hospital, because they are involved directly in the day-to-day care of the patients. They are more involved than the doctors, because doctors would come in, give their diagnosis, give their plan, and then they would leave. But nurses are people who come in every 15 to 20 minutes to check on you. And
Wow.
it's just not a part of their job, it's a particular nurse would come in and ask and just talk to you, like for 5 minutes, as to how you're doing, Priyank, how are things going for you? Do you need anything? So, all these words of kindness do help you get through the day.
You have so many stories of the importance of the nursing profession and the continuity of their care, certainly in the UK, is much better than for doctors.
Yeah.
Are there any other experiences you want to speak about that were particularly meaningful or really challenging?
I think on the challenging side, I would say losing a sense of identity was really hard. Looking at myself in the mirror with no hair, with my skin color faded away, me having significant weight loss, anorexic, all of that kind of help made me lose my sense of identity. And that's something I try to be mindful now as a doctor, to see the child or teenager behind the diagnosis. It also comes back into a full circle. Being in such an environment does affect you in some way and does change you as a person. One of the meaningful experiences I do recollect being talking with my lead consultant for almost 30 minutes, and he just sat with me for some time and he just spoke to me about my illness and how it changes lives. Rather than just focusing on the illness, he was more focused on my well-being.
It certainly sounds like he went the extra mile when communicating with you there, which is really, really lovely.
Yeah. And I feel that is really important, because a lot of doctors do speak to you superficially, this is your diagnosis, this is your treatment, you're gonna undergo, and this is how many cycles you're gonna have, and that's it. So there's no personal or an emotional connection with that person.
Do you have any tips for health professionals when communicating with teenagers with an oncological diagnosis?
Yes. So I feel, make a few playful gestures, or which kind of just lightens up the conversation, the mood. Don't sugarcoat everything. Don't make everything seem easy. Balance truth and compassion. Be empathetic. Be kind. Be humble. I think that's what the teenagers need, other than just false reassurances.
In terms of longer term follow-up, I've heard of the late effects clinic. Can you tell me a little bit more about that?
Yeah, sure. So when I worked back in Mumbai, I did a lot of late effects with my professor, my consultant. So I used to see different diagnoses, different families coming to the clinic. And at that time, it's not just you are an inpatient in the ward. That patient is well, probably suffering with a few side effects. Your role as a consultant would be to just talk to them about their daily ongoings, how they are coping up with their life. Are they having any difficulties in the treatment? Obviously, your late effect tick boxes need to be ticked. You need to get your daily toxicity monitoring, your assessments, your x-rays, CT scans, your disease assessment. But I think going over and beyond that, you need to speak to the patient as to how their mental health is at that time, and compare it to how it was back then. So you kind of gauge their progress, and also if a mental health professional needs to be involved, and also reassuring them that things are going to be fine from now on. You just need to be careful. I'm there with you. So just giving that hope helps.
That's so important, and I think communication's just been a huge recurring theme, really.
Definitely.
Good solid communication and having empathy.
Yeah.
From your perspective, when health professionals do interact with children and teenagers who've had a previous cancer diagnosis, are there any important considerations they should have in the back of their mind? Obviously, these children have had so many experiences in hospital, so they're almost a bit primed for the environment. So it's quite different to a child coming in who's not spent a lot of time in hospital. So do clinicians need to take a different approach when they know that this is a patient who's already, had loads of blood tests, had loads of investigations, had so many communications with doctors? They might almost be a bit more grown up, these children, because of what they've been through.
Exactly. All the doctors need to understand one thing, that patient who has had so many blood tests coming to that hospital gives them a feeling as if they are ill. So just make them feel at home and just make them feel better about themselves.
Of course. And I just think, having that awareness of what they've been through in their past is really helpful, actually, when meeting these patients and speaking to them.
Yeah.
Are there any resources, groups, or charities that particularly helped you or your family that you'd like to share with us?
Yeah, sure. There were a lot actually. When I was treated at St. Jude, which offered incredible psychosocial support, online survivor networks were also very helpful. It helped me get in touch with kids of my age who were undergoing the same treatment. So it helped me talk to them, open up to them. And in the UK, I feel charities like Teenage Cancer Trust and Young Lives versus Cancer are doing a great job and offer great services as well.
The Teenage Cancer Trust that you mentioned, they funded TVs, gaming, jukebox at Bristol Children's Hospital,
Yes.
which just makes the environment a bit more accessible for teenagers.
Yes, and it does help them with their mental well-being as well. They feel distracted. They feel more involved.
You've experienced both sides of being a patient and being a clinician, and you've worked in busy tertiary paediatric units.
Yeah.
What are the most important insights you've gained from these contrasting experiences?
Thanks for asking me that question. So much, actually. As a patient, I learn what it means to feel vulnerable, and as a doctor, I see how stretched the system is. But I also see immense kindness and resilience on both sides. My lived experience makes me more aware of the language, of the silence, of how I deliver the news to my patients. I often ask myself, what would I have wanted to hear back then when I was 17 years old on a bed with a doctor in front of me? And that helps me connect better with my patients. I really hope that whatever I said today, if it even helps one person, it's worth everything, right?
Some really wonderful insights there. Thank you so much for sharing your wealth of experience. Now on to a slightly lighter question. Do you have a book recommendation for us today?
Yeah, sure. So I have two books in my mind, and I've read both of them, which have heavily influenced me and inspired me. Our first is The Emperor of All Maladies by Siddhartha Mukherjee. It is based upon, it's a cancer novel and how cancer treatments were developed 100 years ago and how the generations have changed and how we deal with cancer differently now.
That sounds fascinating.
Yes, yes. And I would do recommend all the viewers to give it a read. It's simple language. It's not doctor language at all. It does make you think as to how aggressive this disease is and how much hard work and so much time, money, and effort has been put in all around the world. The second book I would recommend is The Surrender Experiment by Michael Singer. I think that book was more of a spiritual awakening for me. Sometimes you just need to stop chasing, I feel, life, and you just need to sit back and just let life take its shots. So, and sometimes you just surrender yourself to the situation, to the moment, and you get your answers.
Thank you so much for sharing all your ideas and all your incredible insights.
I'm really grateful to have been speaking today on this podcast with you.
You're incredibly welcome. Thank you for contributing so well.
Thank you, Lorna. This has been actually amazing.